In my work as a GP, we're dealing with people with multiple long-term conditions all day. And apart from the one-to-one of trying to help a patient, are there other ways that we can help people as our population, as society as a whole, to improve health? Because multimorbidity or multiple long-term conditions is a state that's affecting most people as they progress through life. I trained as a GP and I kind of worked through my training, and then shortly after finishing my training I had got into an education and then a research fellowship role, and then heard about the Multimorbidity Programme that really fitted and kind of aligned with my interests for research, and also really complements general practice as a job and what we do day to day. So the programme really appealed to me. What I do now is combine some clinical work as a GP. I work in the same practice that I was based at before, and I do my research work on other days of the week, doing a project looking at multimorbidity trajectories, so the kind of pathways by which people develop multiple long-term conditions. And I'm looking at the impacts that has on people's quality of life and on healthcare costs. We have had access to multimorbidity in primary care training as part of the programme, so that has directly informed my practice just in terms of how I think about providing care in the practice. I would like to think that as my project goes on, because I'm still quite early stages of it, that it will bring even more into how I work with patients in terms of just optimising their health and their life. But if they have health conditions, having their care in a system that is helping them rather than providing more barriers. I think I probably thought that I wasn't necessarily someone who could do a PhD, but I was always interested in research work. And as I said, like the wider determinants of health, of really understanding that it's not just that we're only going to be so effective if I'm sitting with a patient saying, you need to take this for your blood pressure because it's evidence-based. That's missing a whole thing about who that person is and what interaction we're having and what's meaningful to them. So really understanding that drew me to realising actually doing this PhD and doing this sort of work is what's going to move me forward and move us forward in these goals. So that would be the kind of way I found myself there. The beginning of the PhD programme, there's kind of a 6-month run-in period where you're preparing your project up to a certain point before you kind of officially start. I went on to maternity leave during that kind of run-in period, and I would say I was really well supported. It was a great relief for me actually, because it was a new experience for me, and I had, I've gone through medical training and I've gone into training and doing research and juggling those, but I'd had a couple of decades of career before having a family, so it was a whole new thing that I wasn't sure how it would work out. So to have that support and reassurance that was ongoing as well, it was very positive. And I have a helpful, very friendly and motivated team of supervisors who also have families themselves. And it wasn't just talking the talk, but they very much walk the walk of supporting me and reassuring me in that. The department I'm in, which is general practice and primary care at Glasgow Uni, is a really incredible department. It's full of people doing really interesting work and really nice people and very supportive. And the opportunities offered by the programme in terms of support, the training, and as I say, that cohort experience of working with lots of different health professionals, it's, I would say, a massive privilege to be on it.